Today we're going to talk about the different procedures and the different techniques that we have to try and sculpt the buttock. There's many different ways that we can do this. Perhaps the most famous and most popular is what you've heard of as the Brazilian Buttock Lift. That's essentially taking fat from different parts of the body, preparing it, and then transferring the fat to the buttock area, mainly to make it bigger. I ended up perfecting that and essentially not making it just about making the buttock bigger, but about making a better contour, a better shape, so it was more about sculpting the buttock than it was about augmenting the buttock. But not everybody is a sole candidate for the Brazilian Buttock Lift, because sometimes the buttock will have other issues going on that need to be addressed. One of these areas that we're going to talk about today, and it's an area that not many plastic surgeons really pay attention to, but when you do, it makes a tremendous difference in the overall aesthetics of the buttock. The area that I'm talking about is what is known as the inner gluteal fold. That's the zone that's in between the gluteal areas that has a little bit of fullness to it. Essentially, if you look at these patients that are coming up on the screen, the first patient has what we call the ideal buttock. There's not a lot of fullness in that area. It's very mild, very minimal. She has a 45-degree takeoff zone, meaning that the buttock and the legs unite in a very nice, sharp angle. And there really hardly is any fat in that area. But as fat starts to build up in that inner gluteal section,